Children's development and the importance of nose breathing. We know from studies that the incidence of oral breathing or mouth breathing in children, it ranges between 25 to 50%. And the impact of open mouth breathing I'm going to discuss in relation to craniofacial development. It's vital for the growing child that the lips are together and that the child is breathing through their nose. With nasal breathing, the tongue is able to elevate and stay in the correct resting posture in the roof of the mouth. So the child has the lips together and the tongue is resting in the roof of the mouth. And it's the pressures exerted by the tongue that helps to develop the lower half of the face. So as the child is breathing through the nose and as the tongue is resting in the roof of the mouth, the tongue is helping to drive the growth of the face forward. Also with this, when the tongue is resting in the roof of the mouth and the tongue is U-shaped, the tongue is able to help maintain a U-shaped maxilla. The top jaw is U-shaped, there's plenty of room for teeth, but there's also plenty of room for the tongue. Conversely, a child who has the mouth open, they are not able to have their tongue resting in the roof of the mouth, they're breathing through their mouth, their tongue is resting midway or on the floor of the mouth. The pressures exerted by the cheeks are pushing the jaw inwards and the lips pushing the jaw inwards, and they don't have the support of the tongue to counteract the pressures of the cheeks or of the lips. So mouth breathing children are more likely to have craniofacial abnormalities, including setback of the jaws. And the reason that the jaws are set back is because the tongue wasn't in the roof of the mouth to drive the lower part of the face forward in the first instance. The child who has been mouth breathing for a period of time of at least greater than 6 months, and they're also more likely to have narrow facial structure and a V-shaped and a very narrow top jaw, maxilla, and of course, generally it will impact the mandible, the lower jaw. When the top jaw is V-shaped and narrow, there's not enough room for teeth. There's going to be overcrowding of teeth. I've heard many experts talk about the critical importance of restoring nasal breathing in children. All mouth breathing children develop crooked teeth. My dentist, he's Trinity College educated, he's young, he's not yet 40 years of age, and yet he wasn't aware of the impact of mouth breathing in children. So why is it that the dental profession, why is it that only pockets of dentists are really aware of this? Why is it that pockets of dentists are so interested, not just in the teeth of the child, not just, in the aesthetics of straightening teeth, but why are they also interested in airway? And those committed dentists are the ones, they are not there just to straighten the teeth, but they are also there to create beautiful faces. If you were, as a parent, going to orthodontists, there's two different schools of orthodontics. One is functional orthodontics. And a functional orthodontist or dentist is trained to understand the critical importance of craniofacial development for straight teeth. The functional orthodontist is trained to understand the critical importance of a good airway. It's not just about getting the teeth straight, we also have to develop the face. We also have to pay attention to the airway. If the child has the mouth open and the jaws are set back, as the jaws recede, the airway gets smaller. As the child has the mouth open and the tongue isn't in the roof of the mouth, the palate of the mouth becomes high and it infringes on the nasal cavity. So the child who has been mouth breathing for a period of time, and especially during critical growth periods, they will develop craniofacial abnormalities that will impact their breathing and their sleep for the rest of their life. Straight teeth don't create a beautiful looking face, but a good looking face, a face which has developed the way it should do, will help develop straight teeth. So as a parent, if you're embarking on the role of orthodontics, really check whether the orthodontist is going to improve the airway, and improve the aesthetics of the face, that the orthodontist just doesn't see their role as straightening teeth. Straightening teeth is absolutely secondary in orthodontics. Straightening teeth, it should be secondary in orthodontics. What's really crucial here is the development of the face and the development of the airway. There are plenty of associations of orthodontists and functional dentists who understand this and who get it, but not all orthodontists and dentists get it. So if you're in doubt, and if you go to an orthodontist, and if that orthodontist is insisting that 2 or 4 teeth to be removed to make room to straighten teeth, I would suggest you get a second opinion. Best way is early intervention is best. Get your child seen soon. Don't wait until 12 years of age. The face already, most of it, has developed. The earlier a child is seen, and the earlier that an intervention takes place, the greater the likelihood that that growth of the face can be directed so that child can reach its full potential.